Dr. Limongelli, you know, since you're in New York, in the Yonkers area, not too far from New Jersey, let's talk about something which not too long time ago happened. A bus driver suspected of having sleep apnea, and by doing so, he wrapped the bus around a ball. People died, and apparently there are more people having car accidents in the afternoon because of falling asleep than there is people having car accidents being drunk. Now, that's pretty bad. And one of the causes people suspect of doctors lately in the last year, 2 or 3, start suspecting is simply that people have sleep apnea, meaning they kind of snore, and when they snore, not necessarily, but in many times, they stop breathing throughout the night, they don't get the oxygen, and they never fall deep asleep. Thus, they wake up drowsy, they wake up tired, exhausted, and in the afternoon, they just pass out. Can you, you know, since dentists, and especially you, I know you have been extremely well trained in sleep apnea, can you shed some light on that whole situation? How much of it is fiction? How much of it is possibly true or totally true? And most importantly, how can it be helped out if there is such a thing?
Oh, there is such a thing. I happen to be a member of the Academy of Dental Sleep Medicine. And I've been doing sleep apnea for some time now. What you mentioned about the accident on the New Jersey Turnpike is very recent. More recent is when they had a fellow fall asleep in one of the control towers at one of the local airports. Seems that he fell asleep, and the planes had to come in on instrumentation without his direction. Which was a very dangerous thing. They now made it mandatory that 2 people be in the towers on the midnight shift from now on, just to avert such a eventuality where someone might fall asleep. So falling asleep, is a very real thing, especially when people have several jobs, they do multiple shifts, and if they can't sleep well at night, they're going to be tired the next day and fall asleep the next day. Sometimes they fall asleep during reading or watching television or driving or other activities. Most people that come to see me know that they snore a lot. Either they catch themselves or their bed partner tells them that they snore loud. And if they do, they should get a sleep study done. What we usually do is, naturally, dentists are one of the first to recognize this and diagnose it, since we look in the mouth all the time. We can see the size of the tongue, the construction of the throat, and these things that predispose to this condition. I usually send them to a sleep lab where they can get a physician diagnose them and determine the degree of sleep apnea. There's essentially 3 degrees, mild, moderate, and severe. And it depends on if they actually stop breathing, not just snoring, but if they actually stop breathing and for how long they stop breathing. Different appliances can be made. For mild and moderate cases, the dentist can make a oral appliance, which is there's very many oral appliances that can be constructed. They're all based upon mandibular repositioning. What they do is, when inserted in the mouth, they push the lower jaw forward. And as the lower jaw goes forward, it pulls the tongue back off the throat and stops the airway from being occluded, and the snoring will stop. Those of a more severe nature have to get a CPAP machine, which is a continuous positive airway pressure machine. It's essentially a mask with a little air pump that pushes room air through a little canister of water that nebulizes it or vaporizes the air, picks up some moisture from the water so that the air passages don't dry out. And they wear this mask overnight. It forces air down into the airway under positive pressure. so that they get their proper oxygen. Without the proper oxygen level, the sleep apnea can lead to a variety of illnesses, including high blood pressure, heart disease, diabetes, and a variety of other illnesses associated with this condition. So it's a very real thing. It's not difficult to diagnose, but it should be diagnosed at a sleep center where you can go overnight and they monitor you and can actually tell you, what category you fall in, and then you'll know which type of appliance to get. The oral appliances also have an application for patients that were given a CPAP machine but were non-compliant with it.
Which is apparently lots of people who are not compliant because it's just super inconvenient to wear, I hear.
Not only is it inconvenient to wear, but it's noisy, and a lot of their bed partners don't like the sound of it overnight. It keeps them awake.
You mean it's more noisy than the snoring?
Yeah, it's noisy. You hear the air pump running. The Academy of Sleep Medicine has determined that over 60% of patients given the CPAP machine are non-compliant. And for those that are, and when the physicians can monitor the use of the CPAP machine. It has a little card that can go into a computer, and the physician can tell when it was used last and for how long. If they find that the patient is non-compliant, they can send that patient to a dentist and get an oral appliance made. They feel that even though the CPAP machine may be more effective, if they don't use it, it's of no good to them, no help to them at all.
That sounds like the sports teacher I asked which exercise is the best, and he says, Helmut, it's the one which you will be doing. And that made a lot of sense to me. Do you know what I mean?
Yes, that's it. If you don't use it, regardless of how good it is, it's not helping.
Right.
So I see a lot of patients that are referred by physicians that have patients that are non-compliant to the CPAP machine. And we do oral appliances for them, and they do very well with it.
And of course, the oral appliance is also a leg and an arm cheaper than the other one, right? Than the CPAP.
Oh, much, yes. Yes, it is. Although a lot of this is covered by medical insurance.
The CPAP machine?
Yes, it's covered under Medicare, and a lot of the medical insurances cover that.
Okay, all right. Well, that's a good thing. But again,
although with Medicare, I must say, they're finding now that if they find some of their patients that are non-compliant, they refuse to pay for it and have them give the CPAP machine back.
Got it. Makes a little bit sense, I guess. But but the key is to be compliant. To do it, because if you can't sleep because you have it, well, then you defeat the purpose, right?
Yes.
It's just not good. It's just not good. So what you're saying is the very, very heavy cases might need one period. The sleep, the mouth guard for all purpose wouldn't do the trick anymore. The one you make.
Yeah, they probably do need positive airway pressure, because that's the only way to give them the proper oxygen that they require.
But it's
and naturally there is another alternative. The last alternative is surgery, and there's a variety of surgical techniques that can be used. One is to resect the uvula, which is the little appendix that falls down behind the throat in the midline. Sometimes that is so large that helps to occlude the airway too. When they breathe in, it just blocks the whole airway. So some doctors cut that and shorten it, and the airway is opened a little more that way. But mostly in this country now, the CPAP machine and the oral appliances are the most commonly used treatment modalities.
Good. So a person out there snoring or having his spouse snoring, He might also notice that they are sometimes stopping breathing. He might not notice it because he sleeps too heavy himself or her. But when people snore, the chances of them having a sleep apnea is relatively high. Not 100%, but relatively high. Is that correct?
Yes, and a lot of the cases are diagnosed by the spouse.
Yeah.
Yeah.
Yeah. So if a person is snoring and maybe even at the same time, but even if he doesn't, but especially if he kind of says, I do feel a little sluggish sometimes in the afternoon. I do feel like, wow, I sleep, but like, I don't know why I'm still tired right in the morning. One of the first things he should suspect is that his body isn't getting the oxygen and the sleep. It's a double whopper, basically, or a double bummer, where you don't get the oxygen and you're also not sleeping. Both of them are equally bad, and you get them both throughout a night's time when you think you're resting when you're really not.
That's right.
Yeah, I've heard that some people get tested and they sleep 8 to 9 hours, but the test shows that they actually only sleep a couple hours.
That's exactly right.
And they're not even considered the heavy ones.
That's right. That's right. Obesity is another thing that predisposes to this, by the way.
Oh my God! So we had what? Obesity. We have diabetes. We have high blood pressure, and that of course leads to other heart thing. Anything else you said? I forgot.
Yes. No, that was about it.
Okay.
That's about
wow.
it. Yes.
Wow, but obesity, that's a big one. So basically, the obesity comes because a person doesn't sleep, because non-sleeping...
No, it predisposes it because the throat gets constricted because of a lot of fat in the neck. So that is one of the reasons why they stop breathing at night.
Oh, I see. So it's the obesity which makes them not breathing.
That's right.
Not the sleep apnea which makes them fat.
That's exactly right. The obesity predisposes to the sleep apnea.
I see. So you snore, you're a few pounds overweight, you start getting your double chin. Oh my God, I better come and see you. Dr. Limongelli, thank you very much. I think this is very helpful, very candid. As I said, the medical society out there, the medical doctors, over the last year or two have really started realizing that there is a lot more to the problem of sleep apnea, that it seems to be creating a host of other problems which they simply didn't suspect.
That's true, but it's coming to light now, especially with a lot of the news coverage of these accidents.
Right, and because they now they always were happening. It's just now they start realizing this might have something to do with it, and it actually looks like this is despite the fact that it is probably as heavy as cancer and maybe even can cause it simply because you're so stressed all the time, and the depression. Because if you're not sleeping, you're getting eventually depressed. Because you're getting tired and exhausted. But at least the solution for this particular one is a rather simple one, it looks like.
That's true. You just have to get it diagnosed and treated. But it's nothing radical to do that.
And the appliance is not all that uncomfortable. You're saying the appliance is relatively comfortable to...
It is. It resembles a mouth guard, like a sports mouth guard, really.
Mm-hmm.
Only it has a little device in it that helps to reposition the chin forward.
Mm-hmm.
That's really all that it is.
Okay. Well, all right. Thank you very much again.